The priority of the Ministry of Health and Public Healthcare Institutions, or PHIs, is to serve Singaporeans' healthcare needs. Our PHIs are not allowed to actively market themselves to foreign patients. MOH has also recently asked PHIs to cease any contracts with service providers to assist foreign patients referred for medical treatment in Singapore. Today, none of our PHIs have contracts with such service providers anymore. There are foreign patients who travel to Singapore to seek medical treatment on their own accord. Between 2013 and 2017, such patients make up about 1.5% of the total inpatient and day surgery attendances at our PHIs. Those whose referrals were supported by contracted service providers constituted only about 0.4% of attendances in PHIs that had such contracts. Singaporeans remained the majority of patients treated in the PHIs. Foreign patients have not impacted our PHI's delivery of services and subsidized appointment slots given to Singaporeans. In fact, the median waiting time for new subsidized specialist appointments has improved steadily from 28 days in 2013 to 22 days in the first half of 2018. MOH will continue to work with our PHIs to ensure that meeting Singaporeans' healthcare needs remains our priority.
I'd like to thank the SMS for the reply. My parliamentary question was actually prompted by a resident who saw me in late August. Now, he had been referred to by a polyclinic for a specialist appointment for a colonoscopy procedure. And these were the resident's words, and I narrated this to SGH. He was given an appointment 6 months down the road. And the resident told me that, and I shared this with SGH, that only one of the hospital staff told him that only one day of the week is set aside for subsidized patients for colonoscopy procedures. And that's the reason why his appointment was scheduled 6 months later. So I shared this information with SGH. SGH came back a couple of weeks later. They contacted the resident, and they pushed forward the appointment by 3 months. So he only had to wait 3 months. So that's the reason why I actually asked the question whether, firstly, there's any truth to this assumption or allegation that there are specific days set aside for non-subsidized patients and other days for subsidized patients, be it for inpatient procedures or other procedures not limited to colonoscopies. The second question I have is pertaining to the reply that the Senior Minister of State gave, that between the years 2013 and 2017, 1.5% of foreigners were registered for inpatient or day surgeries in our public hospitals. But what's the number, what's the absolute number of that as opposed to a percentage? I believe earlier in October there was a Ministry of Health replied to the Sunday Times clarifying that this number is actually lower than what it was in 2008. At that time it was 2.4%, if I remember correctly. Just to get a sense of the absolute numbers, I would appreciate if Senior Minister of State could share the total number of foreign patients vis-a-vis both percentages.
I'd like to thank Mr. Pritam Singh for the two clarifications. On the first clarification, many hospitals do have a protocol to prioritize the appointment given to patients according to the conditions. If the condition is deemed to be urgent, then the appointment given will be much shorter or almost immediate. And if the condition is assessed to be not urgent, then the appointment date given can be much further away. It could be a few weeks, few months, depending on the type of condition. As to the example or the feedback given by one of his residents, I would find it hard to believe that only one day in a week will be assigned for just colonoscopy for subsidized patients, considering the fact that the department in SGH is actually a large one with multiple specialists performing such procedures. But I think that needs to be clarified with SGH. With regards to the second question on the number of patients, foreign patients that are being seen in 2017, the number is actually 10,900, which actually constitutes only about 1.5% of the total patients seen in Singapore.